Hey, welcome! It's Ashley from Demystifying Your Health. I'm so glad you're here. Today we're going to be talking about strokes. You're out to dinner with your family when you notice that your dad is having trouble speaking. It's almost like he's slurring his words. He's also having difficulty moving his left hand. Is he having a stroke? How do you know for sure? How is a stroke treated? Can you prevent one from happening? Strokes are also called cerebrovascular accidents. Cerebro means brain, vascular means your cardiovascular system, and accident obviously means that something is wrong. It's abbreviated as CVA. There are two main types: ischemic, which means there's a clot, or hemorrhagic, which means there is bleeding. In either case, it disrupts the flow of oxygen and nutrients to the brain, which means that cells that are further away from either the bleeding or the clot start to die. This is why it is so important that if someone has any symptoms of a stroke, they seek treatment immediately. The other issue is, since either type presents very similarly without having some form of imaging, such as a CAT scan or MRI, there is no way to be able to determine what type a person has until that imaging is completed. The treatment for them is incredibly different, even though they present very similarly. Your brain is a very complex structure, and it's actually divided into two main halves inside your head, with one side of the brain controlling the opposite side of the body. So for instance, the left side of your brain controls the right side of your body, and the right side of your brain controls the left side of your body. This is why, depending on where the stroke is located, your symptoms can vary greatly. So if you have a stroke on the left side of your brain, you're going to have paralysis on the right side of your body. You'll also have speech and language problems, which means you might have difficulty speaking, you might slur your words, stuff like that. You could also have slow, cautious behavior, and you could also have memory loss. If you have a stroke on the right side of your brain, you're going to have paralysis on the left side of your body. You will also probably have vision problems. You will have quick inquisitive behavior and memory loss. It's important to note, if you were paying attention in the opening, I said that the individual was having issues with speaking and they were having paralysis on the left side of their body. This can actually happen if a person is having a stroke in the area of their brainstem, which is the part of our brain that controls our breathing and our heart rate. Because of its location, it's actually before where our brain is divided into two halves. So this means if you have a stroke in this area, you're likely to have symptoms from either side. There's a quick and easy way to determine if someone might be having a stroke. It follows the mnemonic FAST. F stands for facial drooping. For this, you ask the person to smile. Make sure both sides of their face are even and one side isn't drooping, or that their face on one side isn't numb. The next is A, which is for arm weakness. Have the person raise and hold their arms up. Usually the good indication is if you have them also close their eyes, because if they're able to keep their arms up, you know everything should be okay. If one arm starts to drift, that can be an indication that the person is having a stroke. The next is S, which is for speech difficulty. So for this, ask the person to repeat a simple sentence, such as, "The sky is blue." If they're able to repeat it clearly, that is a good indication that maybe they're not having a stroke. If they're not able to answer you at all, this is also very concerning. And then T is for time, which means time to call 911, but also take note of the time that you first noticed the symptoms. If you've been with the person the whole time, this should be when they start, or if you've come upon the person and you notice that they're acting this way, which is different from how they normally act, take note of that time as well. This is important when a doctor is trying to determine which type of treatment to use when the person gets to the hospital. When it comes to treating strokes, it really depends on the type. The goal with ischemic strokes is to remove the clot. This is done in usually one of two ways. The first is called TPA, or tissue plasminogen activator, and this is a special medication that helps to dissolve the clot. Obviously, it also increases your chances of bleeding significantly. This is why, in order for a person to receive this, they must meet a specific strict criteria. And one of the elements of that criteria is that the medication can only be given within 3 hours of the start of symptoms. This is why noting what time a person's symptoms start is so key. The other option is called mechanical thrombectomy, and this is when a surgeon actually goes in and physically removes the clot. This can only be done if the person has received TPA and they're not showing any improvement in symptoms, and it's within 6 hours of the start of the symptoms. With hemorrhagic strokes, the goal is to stop the bleeding. So the bleeding is usually coming from a blood vessel that has ruptured and is now causing blood to leak from that blood vessel into the brain. This is most likely the result of something like an aneurysm, which is where the blood vessel, rather than being nice and straight, has a slight ballooning out that eventually ruptures and causes blood to leak out of. Typically, to repair this, you need some form of surgery, which involves a surgeon going in and either clipping the blood vessel to prevent blood flow or surgically repairing the vessel itself. With either case of stroke, it's important to get treatment immediately, because if you don't, the chances of having irreversible brain damage or having death is significantly higher. On a quick side note, I do want to talk about one other thing that does require treatment at a hospital, and this is a transient ischemic attack, or a TIA, or a mini stroke. This is when a person exhibits signs of a stroke that come on suddenly and then go away. This usually indicates that the person is at high risk for actually having a full-on stroke, and this is why they need to be evaluated at the hospital to determine what is the cause of it, and therefore hopefully prevent it from occurring. When it comes to preventing strokes, it's pretty much the same for ischemic or hemorrhagic. The key thing to remember is that certain conditions can increase your chances of having either type of stroke. This is especially true if you have high blood pressure, diabetes, high cholesterol, atrial fibrillation or AFib, which is when your heart has an irregular rhythm that causes blood to pool in parts of it, which form clots that could easily break off and be sent to your brain, carotid or peripheral vascular disease, sickle cell disease, or an aneurysm. It's possible to have aneurysms anywhere in your body if they are caught before they rupture, particularly before they rupture in your brain. Your doctor can do certain things to hopefully help prevent them from rupturing. This can involve putting a coil in the area to fill in the space, which helps prevent it from rupturing at some point in the future. Some other things that you have complete control over are alcohol or drug abuse, whether or not you smoke, what type of diet you have, and what type of activity level you have. It's vital to have overall good health practices because this just keeps your body in good shape and prevents conditions like this and having other issues that you could have if you don't have a good diet, low activity level, and if you smoke and drink alcohol in excessive amounts. If you are currently having issues with this here, make sure you talk to your doctor about making any lifestyle changes before you make those changes, because they will help guide you in a safe manner so that way you don't cause other health problems if you try to make too many of these changes too soon. Strokes are a serious medical condition, but with the proper intervention in a timely manner, it can make all the difference between having lifelong debilitating consequences and making a full recovery. Thank you for joining me today, and stay healthy.